Well, number one, I am a vigorous supporter of the Medicaid expansion and the creation of a very vital health insurance marketplace in Virginia. The law is settled. The Affordable Care Act is legal, and as much as our Republican friends do not like that fact, it is, in fact, a legal situation. And I think it's time for us to move on. It's time for the Republicans to stop trying everything that they can think of to try and avoid the Medicaid expansion, and to say, how can we do this in a way that meets the needs of Virginians? I know people are concerned that 2 years down the road, we will not get 100% of the federal dollars that we would get now if we were taking the Medicaid expansion. But we had the same experience when we did welfare reform in Virginia back in the 90s. We knew that the ideal programs required to help lift people from welfare to work were going to cost tax dollars. We also knew that the economy is cyclical. So we knew there would be times when we could not afford to do everything we wanted to do. And that's the same issue in Virginia with access to health care. It is critically important that we recognize that the two best predictors of how well people will do in life are their level of education and their access to health care. And so my first activity would be to vigorously support Medicaid expansion and the creation of a robust marketplace. I believe that employers should not be the source of funding for health care. We are the only first world nation that does that, and it has put an unfair burden on employers to have to cover the costs of health care. This is an ongoing issue. It's going to take more time and more experience as we evolve in how we provide health care to all Virginians. And I am open and frankly encouraging the examination of a non-employer-based system for paying for health care.